Thank you so much for joining us for Coffee Conversations. With this edition, we would like to talk a little bit about COVID-19 and the updates around COVID-19. We have two very special guests with us today. We have Shirley Bolden, who is our Director of Health Services, who we have consistently had speak with our parents and our families about COVID-19 and its impact on Cumberland County schools. And a very special guest with us, Dr. Jennifer Green, who is our Director of Cumberland County Department of Public Health. Ms. Bolden and Dr. Green, thank you so much for being with us today.
Thank you for having us.
Yes, our pleasure.
So let's go ahead and get started. We want to share some information regarding where we are now with COVID-19. How is Cumberland County doing as far as our case positivity rate, Dr. Green? I know you are spending many days and hours looking at that. So how are we doing now?
So our current case positivity rate is at about 8.7%. Our target case positivity rate is about 5%. That's the recommendation from the CDC and the World Health Organization. Again, we want that number to be closer to 5%, but the good news is we've seen improvements in that over the last few days. So we were up in the 9% last week. So we've seen some improvements in that number. We'd like to see that number continue to decline over the next couple of weeks.
Okay, so we definitely have made some improvement over time, but we still have work to do. So how is the district, Cumberland County Schools being impacted? We have transitioned to Plan A. How has that impacted our case positivity number for COVID-19 cases and students and staff that are being quarantined?
Okay, of course, we've seen an increase in number of students that we've had to quarantine, and that goes with bringing more kids into the building. So that's sort of to be expected. So we have seen an increase in the number of kids who are quarantined, but again, we have more kids in the building. And we have seen our positive cases increase as well. So we are looking, as Dr. Green said, hoping to see this start to trend down in the next couple of weeks. And just reminding parents that, you know, hey, if your child's not well, keep your child at home.
So we definitely know there's a partnership between Cumberland County Schools Health Services and the Cumberland County Department of Public Health. How are the two entities working together in response to COVID-19?
Yeah, I am so grateful for Ms. Bolden and Dr. Conley and everybody at the school district. We would not have made it through this pandemic without the partnership that we have in place from the very beginning. This time last year, we are already talking about school reopening, putting a plan in place for last fall, and that plan is implemented now. One of the best partnerships I think we could talk about is our contact tracing partnership. I think we are one of the first in the state to think about partnering with our school district about contact tracing. Ms. Bolden raised her hand immediately and said, we can do that. And so our staff helped to train her team on contact tracing. So every positive case that comes through the school district, Ms. Bolden teams works on, and then she shares that information with our staff. So that's a great partnership that we've had in place for many, many months to make sure that we keep students safe, identify those cases as quickly as we possibly can, whether that's a teacher, a student, a faculty member, and then quarantine those students that may have been exposed or those faculty members that may have been exposed.
Go ahead.
Oh, okay, I was going to say, I agree. It's been a seamless process. I have point of contacts. Of course, Dr. Green and I communicate as well, but we just have a real seamless process. And when parents are calling the health department, they're getting the same message that they get from health services. And I think that's very important to keep confusion down in the community. And I think we have also done that very well. Our communication is spot on, that we're sending the same message at the same time.
And we have appreciated, even before we came back to school face-to-face, Ms. Bolden, your health services team and the health department were already providing us updates and information so that we can prepare for the transition back to school. So we definitely appreciate that partnership. And you spoke a bit about families being contacted by the health department or by Cumberland County Schools Health Services. If families receive a call from health services, Ms. Bolden, what should they expect?
Okay, we do a mini educational session with families. So we actually, if a child is going test positive, we review all isolation guidelines. So we tell them, how to be safe in your home, how to isolate the person who's positive. What does it mean to quarantine? So we're going to talk to them about, what day does your quarantine begin for the kids or for the staff member after the person in their home has tested positive? What day can they re-enter the school setting? We go and we answer questions like, what happens if my symptoms are worse? So we have 2 people who work at night, and their primary role is to call and do symptom checking. So we care about our families and our staff. So we're calling and saying, hey, have your symptoms got worse? And many times, we recommended that a person follow up with their physician or go ahead to the emergency room if they have shortness of breath. So we're monitoring. So we really have the full gamut. So families really probably almost maybe get tired of us because we're calling daily.
But sharing vital information when you call. So definitely we need to make sure our families are taking the call and realizing that we are trying to support and make sure that they have what they need. So we know that if you've been looking at the news or anything or just following the CDC, we know that younger children have now been approved to start receiving the COVID vaccine. So what do families need to know about the COVID-19 vaccines that have been approved by the CDC?
Yes, this is very exciting news to get more of our community members vaccinated. So last night on Wednesday, the CDC gave their final approval to have vaccinations approved for Pfizer for students as young as 12 years old. So now parents, your children that are as young as 12 can get vaccinated. They do need to get Pfizer. Our other 2 vaccines, Moderna and Johnson & Johnson, are still for 18 and up. But we have opportunities for everybody 12, 13, 14, and 15 to get vaccinated. A few key things to know about vaccinations for teens is about the parental consent piece. So in North Carolina, teens can consent for themselves. So if you are not able to go with your teen, but you want them to get vaccinated, they may be able to consent for themselves. We go off of what we call decisional capacity. So your teens need to have enough knowledge to make healthcare decisions. Of course, we want you to go with them, right? Because your mama, your daddy, your grandma, and you might be the parent and you might want to hold their hand while they get vaccinated. So we want you to come with them so that they feel safe and comfortable. But if that's not a situation that works for your family, teens can also come. Maybe they drive. They can do that for themselves as well at one of our vaccination sites. The key thing to know for in terms of safety and effectiveness, there's no difference in effectiveness for teens versus young adults. And one of the key things I think in these clinical trials for teens is that there were no instances of severe allergic reactions among teens. So we know that these are safe and effective vaccines, not just for adults, but now data says for our younger teens as well. So there are many opportunities in our community to get vaccinated, whether that's with the health department or with Cape Valley Hospital or one of our pharmacies. The key thing here is to parents, we need your help to get our teens vaccinated. If you say it, they will help. They will be encouraged to do that as well.
Thank you. And that's definitely good news as we try to get back to our new normal. And we are now at the point where our students, our children are able to receive vaccinations. And so Dr. Green, thank you for sharing that information. And the Pfizer vaccine is available now, correct?
That's correct. And I thought of another benefit as we think about for parents. If your student has been vaccinated and they are exposed to COVID, the good news is they don't have to quarantine. So as parents are thinking about, man, I don't want my student to miss school if they have been exposed. Vaccination is a great way to avoid that, because if they've been exposed but they're vaccinated, they can remain in that classroom. So this is a great avenue to think about as we move into summer and getting ready for the next fall, is to make sure that our many students as we can get vaccinated so that we can remain in person.
Okay, that is definitely excellent news. Excellent news for our students, excellent news for our parents. And as children are eligible or become eligible for vaccination, will CCS have vaccination clinics available, Ms. Bolden?
We are investigating that idea right now. We would definitely love to be able to offer vaccination clinics like we did for our teachers. And so stay tuned. We don't have any definite information at this time, but that is something we're exploring. And I like to reiterate what Dr. Green said. Please, please, please consider getting your child vaccinated. Again, it allows them to remain in school. And we want our kids there so that they can continue to grow academically. So we thank you in advance for signing up for the vaccination.
Thank you. Any last minute recommendations or thoughts you would like to leave with our families before we end for today?
I would like to remind families that if their child is having diarrhea, if they're vomiting, if they're just not feeling well, and you think, hey, this is usually allergy season, don't take anything for granted. Follow up with your primary care provider, because we want to make sure that your child is well, because our goal is to decrease our case positivity rate. How do we do that? We follow the 3 W's. So if you can enforce that in your home, make sure you wear your mask at all times when they are required, and just adhere to the mask wearing guidelines, follow the 3 W's, and I think we'll be off to a new successful school year before we know it.
And I'll add one more thing. We have an in-person graduation this year. So as we get ready for graduation, this is a great opportunity to get your students at least 1 dose of vaccine before graduation. You have that opportunity this week and next week coming up. And then as we think about moving into our summertime, where kids are going to summer camp, they're going to go see grandma, they're going to maybe get on a plane. This is a great opportunity with these vaccines to keep your family members safe. If you have questions or concerns, we have great, excellent nurses on site. And I know the same is true for our hospital and all of our other pharmacies and locations. If you have questions or concerns, we will talk you through it at the vaccine site. We want to make sure that you feel confident in getting that vaccine. So don't delay. We want you to schedule that appointment. Time is of the essence so that we can bring back summer and get back to some level of normal.
And my final thought is, if your child participates in athletics, especially like our wrestling, our close contact football, basketball, make sure you consider getting your child vaccinated too, because those are close contact sports, and we want to make sure that they're well and that they can go ahead and their team can go all the way to the championship. And they need your baby well to get there.
Absolutely. So again, thank you both so much for joining us and sharing this exciting news, valuable information for us to get to our new normal. Thank you, Ms. Bolden, for joining us again. Thank you, Dr. Green, for joining us today and sharing that information. Thank you, families, for joining us. As always, we want to make sure that we share valuable information that can help you make informed decisions. Again, thank you for joining us for Coffee Conversations, and have a wonderful day.